So now that we do know about Slido, it's time for our national panel to share their information and perspective on the issue. So if you all would come up and take your places. Okay, so the moderator for this session is JT Griffin, right here on the end. And he is a man who works on public policy in MADD's Washington, D.C. office. I've had many email conversations with JT, a few phone conversations, but I never actually got to meet this man until this morning. And he's real. I thought he was just a voice on the end of the phone trying to tell me, what we should be doing in Hawaii. And we kept explaining, no, that's not going to work. But now he's here, so now he'll hear. He is also, I have to tell you, a man who knows his way around our nation's capital. He spent a lot of time in that white building and those other buildings that accompany the white building. So he knows a lot about national, I don't want to say politics, public policy. So JT, I'm going to now let you take over and introduce the rest of the panel as they come up, and the podium is yours.
Thank you. Well, good morning, everyone, and aloha. First, I'd like to start out by saying thank you for having me here today. I'd like to thank Carol and Archie and Teresa, all the folks at MADD Hawaii for putting on this event. And I'd like to thank our panel, too, for being here. Everybody's traveled a ways, and it's really good to be here today. Drug-impaired driving is an important topic, and it's one that affects certainly not only our roads, but it affects our young people as well. And it's one that I'm excited, and I was thinking about exactly what I'm going to say to kick this panel off today. This is an issue that MADD is having a tough time with right now. As Carol pointed out, we recently changed our mission, and I've been at MADD for 11 years, so recently is starting to stretch out, just like I know Carol could tell you as well. But several years ago now, we changed our mission to include help fight drug-impaired driving. And what many of you probably don't know is our original mission actually included drug-impaired driving as part of the issue that we worked on. And what happened is over time, we really figured out that some of the solutions were really difficult to come by, and we dropped the drug-impaired driving mission only to pick it up years later as the issue has sort of slowly reemerged. And so, as I mentioned, it's a tough issue for MADD. And I wanted just to kind of set the stage before the panel begins as to why I'm excited to be here to learn what's going on in Hawaii and in other states, so that we can take it back, and as we're looking at national policies, we can make better decisions about what MADD should be doing. So as many of you know, MADD was really founded working on the issue of drunk driving. It was a group of moms who were gathered around a kitchen table who had lost children and said, we're not going to take this anymore. At the time, and MADD was founded in 1980, drunk driving was really a punchline on late night television, and MADD was really able to change the culture and to change that and to change the way people think, to know that drinking and driving is not okay. Well, we're attempting now to do the same thing with drug-impaired driving, but the challenges are a little different. For one thing, we want to make sure that people don't forget about drinking and driving. One thing that I've noticed that will happen is whenever there's a new issue that comes along, there's only so much media attention that an issue can get. And in this day and age, there's one particular person who tends to take a lot of media attention. And so getting your issue out there it can be tough. And with the issue of drug-impaired driving, there's so many things that are going on in the country right now. We have a national opioid crisis that is affecting children, all the way up to older adults as well. And it's a really important issue, and it's one that I'm sure if you talked with anyone from law enforcement, they would tell you is front of mind because it's something that everybody is seeing. The other issue that's going on in the country right now, which relates to the opioid crisis, is marijuana and marijuana legalization and recreational marijuana legalization. Who would have thought that in today's day and age that there would be 9 states that allow for the recreational use of marijuana? I certainly know that I never would have thought that would have happened in the United States, and so that's something that we're really dealing with, and our speakers are, 2 of our speakers are from states that have legalized for recreational purposes, so they're going to talk today about that as well. The other challenges that we're looking at are impairment. You know, for Mothers Against Drunk Driving, our concern is getting impaired drivers off the road. But where does impairment begin with drugs, and where does it end, and how do we measure that, and how do we come up with laws that will be effective and that will hold up in court? MADD is very good at passing laws. Carol is very good, and Archie is very good at passing laws. It's what we do at MADD. But if I were to ask a table full of experts, well, what law should we pass? I might get 10 different answers, or I might get several people sort of scratching their heads. And so we're not at a point yet where we know exactly what laws we should be focused on and what we should sort of hone in on. I can tell you that MADD absolutely supports our friends in law enforcement on this issue. We absolutely think that the Drug Recognition Expert Program is a very important one, and it's one that we support. We support law enforcement, we support the budgets, the training, all of the things that go along with why that's so important. And you know, the other issue that we're sort of struggling with too is the issue of poly use. You have people who might mix alcohol with drugs, and then they'll decide, well, or law enforcement might decide, well, you know, this person is obviously alcohol impaired, so we're going to make an arrest, and then we're not going to find out whether, you know, they were on some other drugs or what have you. So there's just a lot of layers to this. It seems like at a top level, drug impaired driving seems pretty simple. If somebody's using drugs and they're caught driving and they're impaired, get them off the road. But when you really start to dig down into it, it becomes a much more complicated issue. So I'm hoping that today we'll learn a couple of new answers and learn some new solutions that we can begin to build on, and that MADD as an organization, and I'm representing the national office, that we can build on to make some better policies that we can go out and enact change just like we did in 1980. So with that, I'm going to introduce our first speaker, who is Dr. Staci Hoff. And Dr. Hoff is from Washington State, which many of you know is one of the states that has a lot going on with regard to marijuana and drug use. And Dr. Hoff is the director of the Washington Traffic Safety Commission's Research and Data Division. So I'd like to welcome Dr. Hoff to the stage.
Thank you so much for having me here today. I was just thinking as JT was talking, my boss asked me to make sure y'all know that I'm from Washington State, the good Washington. So we're a small office. We're the Highway Safety Office in Washington State. And I was just thinking back in 2012 when the initiative to legalize marijuana happened in Washington. My boss at the time was like, well, you got to start doing some research on this. It's like, no, I don't want to do marijuana. Everybody does marijuana, right? I want to do DUI courts. And just the nature of this beast has turned me into somewhat of a pseudo-expert. So here I am today to share what I know and what our experience has been in Washington State. But before we jump into that, just a few icebreakers. I'm a data nerd. I'm a math nerd. So I have a couple of fun little puns for you. So we'll start. And if you know the answer, just shout it out. What do you get if you divide the circumference of a pumpkin by its diameter? Pumpkin pie. I knew someone would know that one. So just one more. Why should you never mix calculus with alcohol? You should never drink and derive. Oh, wah, wah, wah. Okay. So what are we going to talk about today? I'm going to share some national trends with you about drug use and drug driving. To, of course, talk about what we're seeing in Washington State and the impact of recreational marijuana. I want to really dive down a little bit into our young and vulnerable drivers. And I have a couple of tips around data collection efforts that will hopefully come out in the action planning this morning. Data is very important. In fact, yeah, we'll leave it at that. I'll get to that slide. Okay. So before we can talk about drug-impaired driving, we need to kind of get an idea of how many people are using drugs to begin with. So this is from a survey done by the Substance Abuse and Mental Health Services Administration, or SAMHSA. This is from the National Institute on Drug Abuse website, or NIDA. And it shows here that illicit drug use among people 12 and older who is included in this survey has been increasing in recent years. And this was an old chart on the NIDA website, but I did find some more data that shows that this upward trend that you're seeing, that green line is illicit drug use, is continuing to trend upwards. The dark blue line right below the green is marijuana use, specifically among 12 and older. And you can see that those are kind of driving each other. If we look at just students, this is measured by grade, illicit drug use, except for marijuana. They track marijuana separately. So while this other survey is showing this trend up among adults of illicit drug use, it's been somewhat flat and even declining among youth in recent years. But again, that doesn't include marijuana. Kana Anamoto, the principal deputy administrator of SAMHSA, has stated that this overall increase in drug use is being driven by adults ages 26 and older initiating marijuana use. So that's why you see that illicit and marijuana trend kind of following each other. But when we look at marijuana use among youth, the good news is that it's not increasing like it is among adults. So that's good news, but it's also not decreasing. And that begs the question of could it be in a different environment? And I think the answer to that is absolutely yes. Some interesting facts about marijuana, though: it may not be increasing. It did decline among 10th graders, according to this survey. It remained unchanged between 8th and 12th graders, despite recent recreational marijuana laws. However, daily marijuana use now exceeds daily cigarette use. That is an alarming statistic. I mean, cigarette use has been obviously declining. There's this huge public health effort for a very long time to move that needle in the other direction. And look what happened in the meantime. Now marijuana is being used more frequently than tobacco among our youth. And this is also at a time where alcohol has been showing significant 5-year declines among youth. So you look at this trend and your first reaction, and you'll often hear this in the media, especially in Washington State, that it's not going up among youth. But everything else is going down except for marijuana. So this is also from SAMHSA. They publish state-level statistics. So I went and pulled over Hawaii and Washington. I thought Hawaii had medical marijuana for a long time. I didn't realize until I got here that it was just last year that you passed that, which makes this slide make so much more sense. Because I was so impressed when I saw Hawaii data that shows youth use of marijuana has been declining every year that they've done this survey recently. And then right below that, you see Washington. So that goes back to that stat again that says, well, it's not increasing, right? Well, it's been completely flat, too. So if I look at a state like Hawaii, who has been able to make these significant declines in youth marijuana use, and it remains unchanged in Washington, that means there's a heck of a lot more that we need to do to move that in the other direction. We do a healthy youth survey in Washington that, like monitoring the future survey that I just showed you, we can add additional questions. So we actually ask students in Washington about driving after marijuana use. And 25% of seniors report driving with someone who has used marijuana. So, and about 20% or 17.6 of the 10th graders and less of the 8th graders. But then we also ask them how many, or how have you ever driven personally within 3 hours of using marijuana? And approximately 16% say they have. So again, this is that caution with the media or even the advocates that say it didn't increase. We did what we were supposed to do, you know, from the Cole memo, which was to restrict access to youth. But I can't believe that anyone would be okay with this statistic, knowing that a quarter of seniors are putting themselves at risk, and not much less are actually putting others at risk when they get behind the wheel. So again, not increasing, but it's still not a good scenario. So drug driving, as you've heard today, we know this is an issue. It's increasing, but we don't really know what to do about it yet. And here's a bunch of websites that is in the handout that you have that you can visit that have drug driving patients and talk about the issues, but don't have a lot of solutions to implement. The exception, though, is MADD. MADD on their website does say that to combat drug driving, we need to continue enforcing impaired driving and alcohol driving. And I agree with that, because it is about the impairment. And if you're out there looking for the impairment, you're going to find it regardless if it's alcohol or drugs or marijuana or whatever else it is that people are impaired by. So moving into drugs and crash risk. It's very different from alcohol. That's one of the early lessons we learned in Washington, is that you can't compare it to alcohol and you can't combat it the same way that we combat alcohol when it comes to impaired driving. You've heard a lot about, the studies are out on how much crash risk is involved with marijuana use. And right now it's generally accepted that about doubles your crash risk, slightly increased crash risk. But I want you to look down that scale of the extremely increased crash risk, 20 to 200 times the crash risk when you have alcohol and another drug in your system. And unfortunately, that's exactly what we're seeing in Washington. Maybe some of you heard that, well, we'll legalize marijuana and people will use marijuana instead of alcohol. What happened? Well, they just use both, right? Because now they're both available. It is so much more complicated than alcohol. According to the Society of Forensic Toxicologists, identifying the link between impairment and a drug level, such as marijuana, is complex and possibly infeasible. That's an old statement. I think most toxicologists now will tell you that it's impossible. So when we talk about setting per se laws for drugs, it doesn't do a lot for the system to combat the impairment caused by the drugs. Alcohol is alcohol, but there's hundreds of drugs to try to profile in terms of the impairment that they may cause and how they affect driving. And because they create different impairment, it creates different impediments to driving as well, so it's very complicated. Data and research on alcohol is abundant, decades and decades of this research, but very limited in the drug arena. Use by drivers for drugs is increasing. You've seen that in your data, we've seen it in our data. While at the same time, alcohol drunk driving is going down. When I say alcohol driving is going down, what we mean in Washington is that alcohol is still the #1 substance. So as JT said, it's very important that we continue to focus our efforts on alcohol impaired driving, as that is still the #1 killer. And it is decreasing by itself. Alcohol only is decreasing. Alcohol as a factor is the same. Alcohol plus is what's increasing. So that's scary. As I said, the impairment can vary. It's very well documented for alcohol and is very consistent from person to person. It doesn't matter as much on your age and your weight and all of that stuff, but drugs varies incredibly from person to person. Crash risk is out, as I already said. But very interesting right now, and an opportunity that we have with education and outreach is the beliefs and attitudes we have about drugs. There's a lot of public indifference about how people feel about drug use in general, and even more when it comes to drug use and driving. Whereas alcohol, with all of our good efforts, I think everybody, even those that engage in it, will admit that it's a very socially unacceptable thing to do. So, how many people drive after drug use? This is from the National Roadside Survey. And as you can see, the chart on the left from the 1973 showed that over 35% of drivers in the 70s were positive for some kind of PAC when they did these surveys. That, of course, has decreased substantially over the decades. Starting in 2007, they started collecting drugs as part of the roadside survey. And in just the 5 years between the two surveys, it's increased dramatically, and of course, marijuana driving that up as well. Unfortunately, Congress has prohibited the National Highway Traffic Safety Administration from conducting roadside surveys. Bummer. This was our only source of national data to describe this issue, and it's gone now. So I encourage states to find ways to continue conducting roadside surveys in your own states. It's just NHTSA funds that can't be used for it, so get creative, and maybe that will come out this afternoon as well. So how many people drive in Washington after marijuana's use, before and after stores open? Before Congress did that horrible thing, the very last NHTSA roadside survey was done in Washington State. They came in June of 2014. Stores opened in July, the very next month. The first one opening on July 6th, and then they came back 6 months after the stores had opened and 12 months to see the impact. And this is what we found from the biological survey. Nighttime is this green arrow here. Can you see my mouse? You can. That didn't change much like alcohol, which is a nighttime weekend issue. We've also seen drugs in nighttime weekend. But what did change, which is this blue line here, this is daytime drug use. Drugs, and especially marijuana, are not a nighttime weekend issue. That's one way that's very different from alcohol, is it's an all-time issue. We look at the crashes involving marijuana, and it's Monday through Sunday at all times a day. There's no pattern to the drug use like we see with alcohol. So that makes it very hard to focus our efforts, checkpoints, increased enforcement when you don't have a time of day that shows that you're going to be more successful than another. 8% before stores open, up to almost 20% after stores opened, a year after stores opened. What this means is that any one time in Washington, at any time of day, you could potentially have 1 in 5 drivers under the influence of THC while they're driving. That's a scary concept. The other thing I'll point out is this purple line right here. These are ones that significantly changed, statistically significant. This is the number of drivers that were actually over the 5 nanogram per se. That went down a lot after stores opened. So I like to pat ourselves on the back for us, because of course that's the Highway Safety Office, right, and our law enforcement. But unfortunately, by 12 months after, it wasn't a significant different from the first wave, and so it probably doesn't mean much. And being over or under 5 nanograms doesn't mean anything. You can have nothing, no detectable THC in your system, in your blood, but still feel the impairing effects of marijuana and still be too impaired to drive. So we also collect some self-report information about driving. It was so funny when we added these questions. Everybody thought everyone was going to lie. Nobody's going to admit to doing this. A lot of people admit to doing it. In fact, 12% of folks that say, yes, I used marijuana in the past 30 days, a third of them admit to driving after marijuana use at least once in the previous year within that 3 hours. This has remained unchanged since 2014. Unfortunately, we didn't start collecting this data till 2014, so we don't have pre-marijuana baseline. But that gives you an idea of the prevalence this is happening. This is a survey that was collected as part of the roadside survey. We did the biological samples, but then also had them complete a survey. We found that nearly 40% of those drivers admitted to using marijuana. One difference here is the first slide here asks 3 hours using marijuana and driving within 3 hours, whereas this question was 2 hours before driving. So that might be, while it's a little higher, but alarming. This is a substantial problem, and a lot of people are admitting to doing this. We have another survey in our state that we administer only to 18 to 25-year-olds. They're a very high-risk group. As fortunately, the number admitting to driving within 3 hours of using marijuana is decreasing, but as of 2016, 42% admit driving after marijuana use. So who's the new impaired driver in Washington fatal crashes? These are the polydrug drivers. You see that red line? This is stark. This is scary. 25% of these polydrug drivers are alcohol and marijuana combined. There's hundreds of combinations for the polydrug driver. But alcohol and marijuana together is the most common polydrug combination. This blue line here, that's alcohol only. That's the decreasing alcohol we talk about in fatal crashes. But again, alcohol is still the most common substance found in our polydrug drivers. Just to be clear, these drivers have been tested for both drugs and alcohol across all years. So this isn't a function of the lab. And I hear all the time, well, you're just testing more drivers, right? No. Does anybody know what happened in 2014 that affected Washington law around our per se? 2014, the U.S. Supreme Court said you need a warrant to get someone's blood. When Washington legalized recreational marijuana, we modified our implied consent laws that says if you're driving on Washington roads, you're giving us permission to take your blood if we suspect impairment. Supreme Court said no, get a warrant. which is fine. If you've got probable cause, they're going to get a warrant. But there was an impact on the number of drivers we've been able to test. So actually, we peaked in 2013, possibly because of that implied consent modification, and it's been declining since then. This is both surviving and deceased drivers in fatal crashes. We do have a law in Washington that says if you die in a crash, we will test your blood without a warrant. So we have over a 90% testing rate of deceased drivers, 30% of surviving drivers, because you've got to have that probable cause. So overall, it's been about 60%, but 2017 is preliminary, so I'm really hoping, we just got 9 more tests before I left, so that only brought it up 1% though, so 2017 could be our lowest testing rate in fatal crashes that we've ever seen. So the poly drug and the alcohol only, how does that break out by age groups? Here's your youngest, the blue at the bottom is your ages less than 20. A quarter of the drivers in fatal crashes that only had THC in their system and nothing else are aged less than 20. It's easier in Washington to get marijuana than it is alcohol, even though both are regulated for those over 21, so that's not surprising. The poly drug affects all age groups. There's not a huge pattern here, although except as you get into these older age groups, it does become a little bit more prevalent. I like to say it takes a little bit of time to develop a multi-drug use pattern, and we see that here. And then not surprisingly, the alcohol only is concentrated at that 21 to 25-year-old age group. So let's talk about the biggest myth. I know you've all heard that I drive under the influence of marijuana because it makes me a better driver, right? So we asked them, as part of our roadside survey, when you use marijuana, how do you think it affects your driving? This is alarming. Over half of 15 to 20-year-olds thinks it makes them a better driver. This is compared to the next age group of 21 to 25. There's usually not a lot of difference between these two age groups. This is a significant difference. So there's an opportunity here. We have to outreach to this very young, very vulnerable age group and bust this myth. The 21 to 25-year-olds even got it figured out. And unfortunately, you mix the impairment with the inexperience of a young driver, and we see you in the data. In just 8 years, we had 76 16 to 18-year-old drivers involved in fatal crashes in Washington state. 54 of them reached their own demise. 22 of them caused the death of another. Of course, usually their close friends and family. So it is very much a problem. Since then, in 2017, unfortunately, this is not uncommon. This is a very severe crash that occurred on July 26th at 4 a.m. After marijuana was legalized, after we knew this was happening with our young drivers, we had a triple fatal crash where this car with 4 teenagers at 4 a.m. hit a parked semi going 56 miles per hour. 3 16-year-olds died. 1 15-year-old passenger survived, and unfortunately, I was not able to find the status on this one survivor, but I'm sure it's not what it was before July 26th. The driver was speeding and had 6.8 nanograms of THC in their blood. This is a graduated driver license violation. They shouldn't have been out at this time, and they shouldn't have had these young passengers in their car. The driver had just got his license 2 months before. His mom said that he had snuck out and suspected that that was the first time he had ever snuck out. Did he fall asleep? Was he distracted by the passengers? Was he looking at his cell phone? Why did he drift from the road that night? Was it the marijuana impairment? Unfortunately, we're never going to know. So let's shift a little bit and talk about the impact of recreational marijuana. On November 6, 2012, that's when Washington voters approved it through an initiative, 56% to 44%. On July 6, 2014, the first recreational marijuana store opened for business. That was Uncle Ike's in Seattle. Since that time, today, there's over $32 million in sales every month from a total of 482 retailers. Since legalization, more than $3.5 billion in sales have been conducted, and that continues to grow each year, and over $1 billion in marijuana and sales tax collected since July 2014. One problem with Washington is none of that money, or a very small portion, 1% to 2%, is dedicated to prevention efforts. So an impact with our lab, Washington has centralized laboratory, which means all of the DUI blood samples go to one place, which makes it really easy for us in data. That's why we have some of this data. But look at the impact of requiring a warrant for blood draw and also setting a 5 nanogram per se level. 5 nanograms of blood, which is the only way to enforce that is to get blood. So of course our tox lab is seeing the impact, and in fact the number of samples since 2009 have nearly doubled our poor lab. What they're also seeing, though, is the presence of THC in DUI cases has been increasing. Right now, it's about a third, but Dr. Cooper, our state toxicologist here, says that for 2018, that looks like it's going back up. We're kind of relieved that it was taking somewhat of a plateau. Unfortunately, it looks like it's increasing again this year. She told me that typically 1/4 of these THC cases are under age 21. THC is the most frequently detected drug, including alcohol, in suspects under age 21. The polydrug chart that I showed you is along those same lines. Again, kind of showing that it's easier to get drugs and marijuana in Washington than it is alcohol. Here's the fatal crash drivers and the involvement of THC at the bottom line there, the light green one. That's total drivers. So considering that more than a third have alcohol in their system, marijuana is still relatively, it's not as bad as alcohol right now. If we look at tested drivers, though, that's the top line. And just like what Dr. Cooper is seeing in the lab, we're also seeing it in our fatal crashes. 25% of tested drivers in 2017 were positive for THC. This is also the preliminary year. More data still coming in, so I wouldn't be surprised if that went up. But again, it's that polydrug driver that we're seeing. 3 out of 4 of these THC positive drivers are also tested positive for alcohol and or other drugs. They're polydrug drivers that we're seeing now. So what are we doing in Washington? We have a study that we're doing with Montana State around traffic safety culture, and the topic we focused on were those folks that admit to DUICA, which is driving under the influence of cannabis and alcohol combined. Not surprising, we found that males are 3 times more likely to DUICA than females. It decreases with age, also not surprising. What is surprising, but also not really helpful, is what doesn't have an effect on a decision to DUICA. Chronic users versus non-chronic users. Doesn't matter. Cannabis being used for recreational, medical, or both also had no effect on the decision to DUICA. And again, whether they were using it for physical, mind, emotional, or spiritual benefit also didn't have an effect. So we're still trying to get our hands around this issue and come up with some smart and targeted education, enforcement, and public outreach to try to put the trend in the other way. So some advice about data as I wrap it up. It's very important. You need to know the limitations of your FARS data. That's why I only showed you Washington fatal crash data, because we don't have good drug data in the national fatality data. Significant limitations, and you can't, the biggest one being you can't tell which drivers actually were under the influence of THC, which is the impairing effect substance in marijuana, versus metabolites that can stay in the system. But if you collaborate with your FARS unit in your toxicology lab, which I believe Hawaii has, because somebody from the health department sent me THC data, which says you guys have good data here too, so that's good. In addition to federal surveys, though, you really need to consider state-level surveys. As I said, we all kind of thought people would lie about the driving after marijuana, and we assume in those kinds of self-report surveys that some people are not being honest, and still we see this high prevalence. So that's the minimum. It's probably higher than that. Partnerships are essential. Find out who got funding and get creative. Reach out and make sure they're also incorporating traffic safety data collection, messaging, and research into their efforts around drug use and, of course, drug-impaired driving. And look for opportunities to work with the industry. In Washington, these are business owners that have an interest in safety outcomes, in particular with marijuana-impaired driving, so there's opportunities there. And this was something that came out in one of the first stores that opened. It was one of my favorite things that I saw come from the industry, which these are rolling papers they were handing out to their customers that showed the 2 cars separate, and then when you rolled it into a joint, it showed the cars crashing. So I thought that just was an amazing effort on behalf of the industry to do that. And I'm not going to go into this because Mike's going to talk about this, but here's just some resources that we've put together to deal with this in Washington. I really like You Can Washington. It's our newest effort, and it's all around positive social norming. So it's not negative and punitive, and this is the bad stuff that's going to happen. This is your brain on drugs, right? It's more about here's what you can do. It's empowering, so I like that. These are also all in your handout, and you'll have my slides. So mahalo, thank you for having me.
Okay, well, thank you, Dr. Hoff. We appreciate that. Next up is Chief Bob Ticer, who is a 29-year veteran law enforcement officer and currently serves as the Chief of Police in Loveland, Colorado. So please welcome to the podium, Dr. Ticer.
Chief Ticer. She's the doctor. She's the doctor. I'm just a regular guy here. I'm just going to leave that up there because that's a nice start of the screen right there. That's a great presentation, Staci. Did a wonderful job there. Let me see if I can get mine pulled up here. Pressure's on. Here we go. All right. Well, thank you. And thank you to this great state. It's a beautiful state you have here in Hawaii, and truly honored to be here. After 29 years in law enforcement, I finally had an on-duty paid trip to Hawaii, so I got it. 29 years it took, so thank you for that. But yes, certainly when my friends at MADD asked me to come out here and spend a little time with you, I thought, yeah, absolutely, I'll come to Hawaii and see you. I've had the opportunity because I'm from the state of Colorado, right? So to speak about this topic, and my background and my career has been very heavily focused in impaired driving, in drug recognition. That's my background and that's my passion. My dad was on the highway patrol for 20 years before I was on the highway patrol for 20 years, so I've been involved in traffic safety since I was in diapers, and here we go. Challenges with marijuana. And I wasn't texting, like watching baseball scores over there. I was trying to respond to some of your questions on that app, so that's pretty good. I'll make sure I have that on today. I'm sure my colleagues will as well. So when I'm not up here speaking, I'll try and answer your questions. And we're also going to be here for the entire conference. So please catch us in the foyer or wherever, and we'll help you any way we can, because we only have about 20 minutes to talk about this, and I could spend days talking about marijuana. So I'm going to go through it rather quickly, try and hit some of the highlights of what's going on in the state of Colorado. It was snowing there yesterday when I left, so another really good reason to be here in Hawaii, for sure. So back around 2013, marijuana became legal as in a state. It was a constitutional amendment, Amendment 64, for recreational purposes. It's still a federally controlled substance. I think we all need to understand that this is still a Schedule I federally controlled substance at the federal level. It's illegal. It's against the law. But the state of Colorado voters voted to allow it in some type of recreational form. Prior to that, there was medicinal marijuana. They're still both in Colorado. And I thought when recreational marijuana was passed by the voters with Amendment 64 that medical marijuana card recipients and holders would actually go down. They've gone down slightly, but there's still some benefits for people that hold medical marijuana cards in Colorado. And it's not a prescription. You're going to hear that it's a prescription from a doctor. A doctor can't prescribe a federally controlled substance and something that you're going to put carcinogens in your lungs and say that it's okay to do that. They can't do that. So they do it's called a recommendation. It's like a prescription, but it's a recommendation, and then people can go take that recommendation to the state and get a medical marijuana card, and then they can purchase medical marijuana. There's some benefits to that for the people in Colorado. It's cheaper because there's less tax on the medical, and there's also a gap. Because if you're 21 and older, you can just go into a dispensary, purchase marijuana, or you can grow a certain number of plants and you can have that. But if you have medical, you can get a card at 18. So there's that gap right there. So 18, 19, and 20-year-olds can possess legally marijuana in the state if they get a medical marijuana card. So there's some gaps there. What does Colorado look like right now? There's a lot of marijuana stores there. There's a lot of dispensaries. There's more than there are Starbucks, right? Can you believe that? Go to Denver, Colorado. Drive down to Interstate 70. I would say roll your window down, but you actually don't have to roll it down if you have your air conditioner on. You're going to smell. I'm not kidding you. You're going to smell marijuana coming out of the warehouses there where it's being produced and ventilated into the air. That's what it smells like in certain portions of downtown Denver. There is a lot of marijuana out there. As you can tell legally over 300 tons metric tons of marijuana was sold in dispensaries throughout the state of Colorado just last year. And you can see right there, Staci, some of this data that we have in Colorado is very similar to Washington State. You'll see right there, the majority of the card holders are men, 18 to 40 years old, right? Majority of the recommendations that come in are for severe pain, and only a very small percentage of those recommendations are for such things as cancer, glaucoma, HIV, or even seizures. But you're going to hear that when the industry comes to you and says we need recreation or we need marijuana to be legalized. They're going to talk about it for medicinal purposes, but in reality, very small percentages are using it for what you hear about it for the seizures, glaucoma, etc. And you can see right there, estimated 687,000 users in the state is the estimate of how many people in that state residences are using cannabis in Colorado. That does not take into account the tourist. And we have a bunch of them out there. I was talking to a gentleman from the police department here a little while ago. He's familiar with the skiing in Colorado. If you like to ski, it's a great place to ski. Hundreds of thousands of people come out there to ski. Hundreds of thousands of people come out there to recreate. And people actually are coming to Colorado to recreate with cannabis now. So that number is certainly higher when you add up all the people that are coming to the state to recreate. I put a lot of information in here. I was looking at the attendee list in this group here, and I give you information so that when this type of legislation comes to your state, some things you need to be aware of, to ask questions, to put in front of legislative committees. The governor put a task force together out in Colorado when Amendment 64 was put together. They brought a lot of people in the room, and there were two things that came out of it specific to traffic safety. One, recommendation. We are all familiar with the .08 per se laws, right? Every state has a .08 where it's a certain number that society says, science says that when you get to a .08, you're presumed to be under the influence of alcohol, right? We're all familiar with that. Well, Colorado legislature decided to put something in law, put a number attached to marijuana, and instead of calling it a per se, they passed it and called it a permissible inference. That's actually a very weak per se law, which actually is an instruction that goes to a jury that says you can infer that if a person's arrested for driving under the influence of drugs, in this particular case cannabis, and it's the only drug category that has a number attached to it other than alcohol now, that you can infer that the person was under the influence if they have 5 nanograms or more of THC in their blood. That is not good law. That's not good legislation. And just this week at the International Association of Chiefs of Police Conference in Orlando, where I was at, and I sit on the Highway Safety Committee right there, we passed a resolution through that entire body of the International Association of Chiefs of Police to send a message out to states that it is our recommendation that you do not set a per se law for cannabis out there, because we say focus on the impairment, not the number. And the reason why that is when an officer makes an arrest for somebody under the influence of cannabis that's driving, their nanogram levels spike up so high after using cannabis, they fall off so fast. So when the person's coming in and getting the blood test, which sometimes can take an hour or two later, those nanogram levels are coming significantly under the 5 nanograms, and those cases are being dismissed. So it's something to really pay attention to, and I would recommend if you see that legislation coming your way in Hawaii that you stand still, you pull out this resolution and you say it's not recommended that we do that. There was also another good intent that came out of there, and that was to train police officers more in the advanced roadside impaired driving enforcement. That's a 16-hour block of instruction to identify drug impairment, and then also to certify the drug recognition experts at a higher rate. And that's a real significant training component that goes into law enforcement. There's about 9,000 DREs throughout the world. About 1.5% of American law enforcement officers are DREs. However, not every police officer should or could be a DRE, because you have to find the passionate officers that are specifically passionate about impaired driving enforcement to certify. So what we did is we found that there's dollars available now in Colorado because of the tax revenue that's coming in. We've tapped into that, and we are now training officers in A-RIDE. My department, I have 113 sworn police officers on the Loveland Police Department, and we put every officer through A-RIDE training now so that they have a higher awareness of drug impairment, not just cannabis, but drug impairment. And we're getting more officers certified. We're using those tax dollars to pay for that. Also in Colorado, they had to create an entire new police department. It's called the Department of Revenue Medical Marijuana Enforcement Division. enforcement division. So what they did is they took these tax dollars and they created a government law enforcement agency attached to the Department of Revenue, just like state liquor enforcement, but they're marijuana enforcement agencies, and they're responsible for regulating the dispensaries throughout the state. So they handle that. Local law enforcement still handles the crime and associated crime on the street, at the street level, municipal level, but these agents handle the regulation just like liquor agents do. So I had to create a whole new department there. People think that it's running amok with dispensaries out in Colorado. There's pockets. Actually, 65% of jurisdictions throughout the state have said no to any type of dispensaries. So you can actually opt out. We're a home rule state, and that's a good thing. That's good policy. My community of 80,000 people in our city, we do not have any dispensaries at all. You can still possess and use the marijuana in our community, but you can't buy it in a dispensary. Now you go next door to Fort Collins, which is a university town, and you can buy marijuana in dispensaries there. As a matter of fact, there's dispensaries right across from the university where my son goes to college. You can see it there. And this is just a map of what that looks like in Colorado. You can see all the green right there are areas where you do not have dispensaries, but you can see in the middle part of the state, that Denver region where population is, there is a lot of dispensaries and a lot of sale of marijuana under the Amendment 64 legal aspect. What challenges do we have in law enforcement? I know there's not a lot of law enforcement officers in this group today, but I think it's important for you to understand what challenges we have so you can communicate that out with your colleagues and your friends and talk about that. Well, a police officer has to know a lot about everything, and they have to deal with constant changing laws now. So when they stop somebody, I'll give you an example. I stopped a kid, I don't know, a few months back. He was speeding. I was behind him, pulled him over. I saw this glass jar of cannabis down by his foot. He had, I don't know. Why would you have that down by your foot? I think he put it down there so he didn't think I'd see it, but I've been around for a while, so I saw it. And so I was like, oh, let me see your license. And he gives me his license, and he was like 19. And I thought, oh, this guy's, violating the law. And I'm like, hey, what's that by your foot? And he's like, what do you mean, what's by my foot? I'm like, the jar with the marijuana in it, that's right by your foot. And he goes, oh, this. I said, yeah, that. I said, that's marijuana. He said, yes. I said, well, you're only 19, you can't have that. And he goes, but I got a medical marijuana card. And so he had that. So I gave him a warning for speed. He wasn't doing too much over the limit. I made sure he wasn't under the influence, and I let him go with his marijuana. So we have to continually educate our officers on what is legal, what is the legal amount you can have. Can you have 1 ounce? Can you have 2 ounces? You can have 2 ounces if you have a medical marijuana card, but only 1 ounce. You can have 6 plants, but only a portion of them can be planting. You can be a caregiver for others. I'm not making this stuff up. You in Colorado, you can grow 6 plants, right? But then you can be a caregiver for you 5. You 5 right here, I can be a caregiver for you, and I can grow 6 plants for each of you. And there's no requirement. I don't have to go get a degree in chemistry or botany or anything like that to be a caregiver. I just need to know how to grow marijuana plants. Yeah, right. So how many is that? 5 times 6, that's 6, 36 plants. I've been in houses where you go in, people are caregivers, and they have 36 growing plants of marijuana in their condominium. And when we leave, nobody's in custody and no citations are made, and no marijuana is taken. So these are the things that we have to keep our police officers up to speed on, what's legal and what's not, or what's illegal. It's very challenging. Liabilities for seizures of illegal marijuana. At one time, years ago, departments were actually keeping plants under grow lights because they were afraid that they were going to die, and then they would be on the hook for liability for thousands of dollars in marijuana. Not in my department, but other departments, that was happening. So we got through that. We don't have to do that. But I got an opinion from a United States attorney in Colorado years ago, and I said, what if I give marijuana back to somebody where we had seized it? Would I be in violation of transportation and selling or of marijuana laws? He said, yes, you would be under the federal laws. So these are the challenging things that we have to deal with. Dealing with tourists. In Colorado, there is a lot of breweries. Actually, there's more beer microbreweries in that state than any other state in the union. Washington may say there's more. Oregon, I don't know, but I'm from Colorado, so I say we have more. But what's happening is people are coming out there to be tourists and consume alcohol, recreate, and then they decide they want to take some marijuana because maybe they haven't used that in a couple decades and they want to see what's going on. The marijuana that we have out there nowadays is at such high levels of THC, or it's edibles, it's being eaten, and people are getting very sick, and they're getting themselves in a bind. So we're dealing with tourists significantly who are getting overexposed and dangerously high. A lot of the local, those 600 and some thousand people that live in Colorado, they're figuring it out how to use the edibles and how to use the high concentrations of marijuana out there, because it's been around for a handful of years now. But the people that are coming there, they're finding themselves in serious business, especially if you ski. Skiing's hard. Anybody skis, it's not easy. It's hard. And if you're under the influence of alcohol or drugs or cannabis, it's even more difficult. So I don't know why people do that, but they do. Other challenges that we're dealing with, canines. Do you all have canines here on Honolulu PD? We have canines in the police departments here. We have several on my department. And my dogs, we have 4 patrol dogs, 1 bomb dog, but let's talk about the 4 patrol dogs for a minute. Those dogs are trained to sniff for illicit drugs, right? My dogs are newer. Others have aged out. So when we trained our police dogs now into what they're going to be able to smell for, what drugs are going to be able to smell for, we did not introduce marijuana into them anymore. So my dogs will not alert to the presence of marijuana. Now, when you train a dog and you put the presence of marijuana in their sniffer, you can't take that back out. So you have to start fresh. So the dogs in the state that have been trained in marijuana smell, they're still sniffing. And here's where the problem happens. When a dog sniffs around a car, let's say, and they're sniffing for the smell of narcotics, if they smell a narcotic, let's say it's cocaine, heroin, marijuana in the past, fentanyl, whatever, you name the illicit drugs out there, they're going to alert to it, and they're going to generally sit down. And that's going to tell their handler, I smell an illicit drug in there. Now, they don't sit differently for cocaine compared to methamphetamine, or raise a right paw for marijuana. They just sit. They just sit. So when they smell something, you're like, aha, they smell something illegal. Well, when we had them smelling for marijuana, they were sitting all the time. So we're like, we got to do something. So no more marijuana smells for my dogs. But the cartels, the drug dealers, they're very smart. They can easily put loads of cannabis or illegal use of cannabis in a car now for those agencies that still have the dog sniffing for marijuana. The dog alerts to it, and then let's say that they have a cover load of cocaine or methamphetamine that's being transported. The dog alerts to it. The person can say, well, it's because I have my marijuana here, and it's a legal amount. What does that do? The officers have to work through that, and oftentimes they're missing the drugs. So these are real challenges that we're working through. And we have to keep our officers motivated, because what do we hear? We hear our police officers going, why should I continue to make these arrests when they get dismissed or when juries say not guilty? And that's the job of law enforcement leaders, is to say, do your job, keep working hard, keep the fight going, and we'll let the prosecution and the juries make their decisions, but we have to work real hard at it, and it takes a lot of effort to keep that motivation going. The drug dealer still lives, big time, in Colorado. When legislation comes to a state, you're going to hear that this is going to wipe out drug dealing. Not the case, because I'll give you some numbers here in a minute that shows you how high the cannabis is taxed in retail stores, nearly 30%. So to go purchase marijuana in a store, it's very expensive. It's basic supply and demand, basic capitalism. Drug dealers can sell that product at a heck of a lot lower rate. It's not taxed, and you can buy as much of it as you want. So this is a picture of, I think, 76 plants that was just a block or so from our city hall that I went to when officers were out on a case the other day. Nobody went to jail on that. Difficult to prosecute these cases, but there's still plenty of drugs out there that are being sold. Plenty of it. It has not reduced it. What do we know at this juncture? Similar to what Staci said, youth marijuana use, age 12 to 17, Colorado, about 9.08% of kids 12 to 17 have recently used cannabis. That's higher than the national level. Now, that number has slightly gone down from around 11%, but it's still significantly higher than the national level and ranks about number 3 in the nation. Now, you see that college-age marijuana use at 18 to 25, those are those dangerous drivers. Remember, I showed you the makeup that 62% of males are using medical marijuana, using cards on that. 32.2% of them are using cannabis compared to about 20%. That's a significant number. And those are the drivers on the road that we're dealing with. Adult marijuana use, more than double the national average at 14%. The big alarming problem here is the increase in the potency of the THC that we're seeing out there, and the edible consumption and the high THC consumption that's going on. I don't have time to talk about these numbers. I know they're right out there at the Rocky Mountain HIDA report. Emergency room visits have gone up significantly. Diversion of marijuana outside of Colorado. I was Arizona State Trooper for 20 years. We knew when grow season was happening in Mexico because marijuana would be coming up the interstate and being dispersed throughout the country in big bulk loads, right? Well, the border now is Colorado. It's being dispersed throughout the rest of the United States. High-level grade marijuana that's going out there. You don't need to bring 200 pounds of marijuana out of Mexico anymore. You just need a few pounds of Colorado high-grade marijuana. So it's easy to conceal, and it's easy to move throughout the country, and there's data that's showing a lot of marijuana is moving out. A lot of it's also going out through the Postal Service, UPS, FedEx, and the U.S. Postal Service at very high numbers out there as well. Crime is going up in Colorado. I'll give you some data there, but not in the city that I work in. I'll tell you why in just a minute. We're going to talk a little bit about impaired driving. A few things for you to think about. When all this happened in Colorado, the chiefs were not happy. We were like, oh my gosh, we used to arrest somebody for a joint and tow their vehicle when we came on. We don't do that anymore. So we were like, what has happened to this law? And we weren't too happy about it. So let's look at it from a positive. We got more training. We got better training. I trained all my police officers in my department, including the detectives. What did I hear from the detectives? They're like, oh, geez, Chief, you want us to be traffic cops too? I'm like, oh, I just want you to be focused that this is a dangerous situation on the roads with impaired drivers. And because of that and the focus on traffic safety in our department, we've increased our driving under the influence of drug arrests and DUI arrests at those very high numbers in 2017 based on the 3-year average. What's happening? Our crime's going down. And our DUI-related crashes are going down. Our crashes are going down because we have focus on traffic law enforcement in my city. I mentioned to you about the 5 nanograms. We already covered that. Data collection, you heard that from Staci, is difficult for DUI and marijuana. We have to be better on that, and I would say get ahead of that right now. And let me give you some examples, and a lot of it's based on cost. When a police officer makes a stop for a DUI, and the person's got alcohol on board, and they blow over a .08, that's generally it. That's the last test that's done. That's a breath test that's done. Ticket's written, the person's booked, they go to the court system, and they get their DUI conviction. Even if there's other drugs involved, it usually just stops at the breath test, because with drugs you have to have a blood test, or in some states a urine test. And once that .08 magic number, which is going to get a higher likelihood of a conviction, is going to occur, generally the blood test doesn't occur. So we're missing plenty of drivers out there that actually have drugs on board that we just don't know because we're prosecuting them for the regular DUI with the alcohol. So something to consider. There is a lot of marijuana in the DUID, driving under the influence of drug arrests. Some numbers right there by the State Patrol. 74% of their DUID arrests have marijuana exclusively, or marijuana in combination of other drugs out there as well too. And so that's just on the DUI drugs. Statewide fatality numbers, Colorado numbers have gone up 33% since 2014. Those are overall traffic fatalities. You can see the problems that we have with the data. We just hadn't been getting the data, so we're doing better on it. But you need to establish that baseline right now. Still really work hard at getting the data solid. High number of the DRE cases involving cannabis. And just like what you heard with Staci in Washington State, the Colorado Department of Transportation has just done some recent surveys. And I think they surveyed 11,000 people, a pretty significant number. And this is what they found: 69% users of cannabis admitting driving after using marijuana. And alarmingly, 55% of these respondents said safe to drive after using marijuana. We got a big challenge right here when it comes to community education. We have to get on this really hard, because those are the people that are driving, and they believe that to be true. You're going to hear a lot of people, and you probably already have heard, say marijuana is not as dangerous as alcohol. I would say when you hear that, you say marijuana is dangerous, alcohol is dangerous. They're just different drugs. You can't compare them to the two. You can see right here, average number of marijuana fatalities, drivers testing positive with cannabis in their system, has gone up significantly on the averages. Now we're averaging 98 per year. And 76% of those drivers tested positive for THC. So when you see that number 98, that's having cannabis in their system. But when you get into the delta-9 tetrahydrocannabinol, which is impairing substance in cannabis, you can see 3/4 of them had that in their system as well. And here's some numbers from Colorado Department of Transportation. They put out, they're still waiting on the 2017 data to update this slide, but this gives you an idea of fatalities with drivers testing positive with the delta-9 THC. And you can see that steep curve going up from 2013 when Amendment 64 was passed to where we're at now. And there's no doubt those numbers are going up. There was a question that came on the iPad a little while ago from somebody on that I responded to that says yes, they are increasing. Colorado DRE and A-Ride. JT, what do I got, maybe 5 minutes or so? Okay, about 6 or 7 minutes maybe, 10. We got you all day. So a lot of DREs. I heard from a highway safety office, you have about 80 here in Colorado. Probably could go up a little higher there, but it's a good number. 228, there's more population in Colorado. We have grown that significantly, and we've used tax dollars from marijuana to pay for it. And we're getting all our officers trained out there. The Colorado State Patrol have gotten all their troopers through the A-Ride curriculum, and so has my department. Crime in Colorado increased 11%. That's a big joint, isn't it? I mean, you don't need a joint that big anymore. You don't. You do. That's like a 1970s picture or something. You don't need it that big. All you need to do is get some shatter or wax that's got 99% THC, get one hit on it, and you're smoked. You're smoked for hours and hours. It's just a funny picture. I had to get on there, but you don't need that much anymore because it's such high numbers. In Loveland, I'm very proud about this, and I put the pressure on my fellow chiefs to say, hey, you guys are complaining about crime? Not in my city, because we're focusing on traffic safety. We made 17,000 traffic stops last year compared to 11,000 the year before. Coincidentally, that was about the year that I came as the chief into that town. And guess what? Our crime's going down, and our crashes are going down. First time we've had a reduction in crashes in years in the city of Loveland. You can do that with strong traffic safety programs for your law enforcement agencies. And unlike people think, it's not a free-for-all. You can't walk around smoking marijuana in public in Colorado. Just like you can't walk around drinking a beer, you can't do that in public. It has to be in private. So consumption tickets are up as well. Some great campaigns out there. Mr. Sandoval is going to talk about some of the campaigns. National level is using this Drive High, Get a DUI campaign right now, messaging out a lot to that younger age group and men, trying to get it on the TV during a time when football's on and other sporting events are on. And then CDOT just put this out there. This is pretty cool. When you go into a dispensary to purchase marijuana, they actually have some PSAs here. I'm going to put them on. They try and do them kind of in a funny way, but try and get the message out. So here's one that you can see if you go to a dispensary. You might see something like this.
I actually drive better when I'm high.
The police can't tell that I'm driving high.
Community education is huge. You got to work on it. Colorado Drunk and Impaired Driving Task Force. I chair that for the state. It's a statutorily mandated task force. Very robust group. It's got police. It's got victims. It's got defense. It's got prosecution. It's got the liquor industry. It's got all this on there. So years ago, the State Patrol Colonel was the chair of that task force, right? And I was coming there representing the Chiefs Association. And there was a gentleman from the marijuana industry that started coming to these public meetings, and he was talking about marijuana. He was really getting under my skin. I'm like, this guy is driving me crazy. So I go up to the colonel. I'm like, Colonel, you got to get this guy out of here. He's like, no, settle down, Bob. Just hang out. He'll be fine. Maybe he has some input. So he kept coming back to the meetings. Colonel retires. I became chair of the task force. We open up a bill down the state legislature. Now we have not one, but now we have 2 members from the marijuana industry on our task force. They sit right next to Miller Coors. They sit right next to me. They sit right next to public health. They sit right next to all of us in there, and they are all focused in there, including the marijuana industry, on reducing incidents of DUI. So we had to form these partnerships. We also have the executive director of MADD on that task force. We have representative from victims who's generally connected in the MADD that sits on that task force too. So we've just had to change the way we do business out there, and they have a lot of pull with their consumers out there, and they can message out what we're trying to do. Let's not forget about tax money. I'm about to wrap this up. $232 million in tax money came in on state tax money. That doesn't include the municipal taxes that get put on top of that. It'd be hard for me to try and find out what that number is. But when you hear about the tax dollars, this number is actually less than 1% of the entire Colorado state budget. It's a lot of money, but it's significantly less than what maybe the public hears it to be. Lessons learned and challenges, couple slides less. There's opportunity to focus on DUI enforcement. I think JT mentioned that earlier. Engage the public now on DUI, not just DUI marijuana. We talk so much about marijuana, but there's opportunity to talk about all types of drug impairment, all types of alcohol impairment when it comes to driving. Position your agency for that funding. There's dollars coming in, and grab it. Make sure you have your experts and the right people at the table when these bills pop up down at your state house. And takeaways. Community education now, we have to be talking about this, especially when you hear that these users are saying, 55% of them in Colorado saying, I'm okay to drive after I've smoked marijuana or ate marijuana. No, you're not. And we have a lot of work to do on that. Blood evidence, oral fluid testing. There was a question that came up on the app a little while ago on that. Our statute in Colorado prohibits police officers on the roadside to use oral fluid testing. So we have to change that. We're going to have to work on that. Some states you can do it, Colorado you can't, so we have a lot of work to do there. And that last one's so important. I typed that one in last night. What my challenge is to you, everybody in this room, is go to your law enforcement leaders. Go to your chiefs. Go to the chief of Honolulu PD. Go back to wherever you're from. Find your law enforcement leader. Get a meeting with that person and go in there and let them know. Demand that their department focuses on DUI enforcement. If we focus on DUI enforcement like we're doing in my city, you will reduce incidences of impaired driving. That law enforcement officer has to go out there and work hard to do it. There was 1.2 million DUI arrests in this nation last year. There's 700,000 police officers. We can do more. I think in law enforcement, we can actually eliminate DUI in this country if every law enforcement officer, from the detective to the patrol officer to the chief of police, gets out and focuses on DUI. We can do it. But we need you all to go to those leaders and say, please, we need your help. We need your help. And they'll listen to you. They're used to hearing from me, but they need to hear from you all. And I know many of you do that, but re-engage, work hard at that, get that message out there. And that's my presentation. Thank you, JT.
Well, thank you, Chief Ticer, and boy, that was just great to hear about engaging with law enforcement leadership. I think as a room full of activists and advocates and people who are community leaders, it's just a really good reminder that we need to be engaged, encouraging law enforcement to conduct. I've often said the best way to stop drug impaired driving is to do more drunk driving. It doesn't really matter how you want to look at it, impairment versus impairment or what have you, but the more we're working on getting impaired drivers off the road, the safer that our communities will be. So lastly, but not leastly, I would like to introduce Mike Sandoval. Mike is the director of the New Mexico Department of Transportation, and please welcome Mike to the podium.
Thank you all. I know it's been a long sit, so I'm going to try and get through this relatively quickly. I went ahead and left my jacket at my chair because I was told when I walked in that they could tell I was from the mainland because I had a suit on. So I'm going to go ahead and leave that there. I also want to give a big compliment to the person that wrote my biography, my bio, because I'm notorious for not sending pictures in bio, and she called me and said, well, I found some stuff on the internet I'm going to put on there for you. There's a lot of Mike Sandovals in Santa Fe, New Mexico, so I wasn't really sure what she was going to find, but it all turned out okay. So I just want to compliment her on that. My job is to talk to you a little bit about public awareness and what we're doing in New Mexico and how important that is in solving this problem. So there's a lot of video on here with commercials and other things. I do want to say that there are some crashes on this, not kind of blood and gore stuff, but some pretty powerful spots. And I know if you're a victim of drunk driving, which a lot of us are, we either personally or we know somebody, they can be very powerful. I just want to put that out there right away to you, because I was asked about that at the beginning. I'm from the New Mexico Department of Transportation. Been doing this for about 24 years now, getting close to retirement, all right. This is a pretty good place here in Hawaii to come if you want to retire. My second time out here, but looking forward to my next couple days here. It's a great place to be. I want to let you know, really appreciate the first two speakers. There's really three things that I think people need to focus on if they want to stop impaired driving, and this includes drugs. And I appreciated the Chief's comments. I'm going to kind of echo what he said in a little bit. But legislation, enforcement, and public awareness are the place that you really want to focus. And I know there's treatment and drug courts and all these other things, but these are the three things that can really have an impact on reducing crashes or ending crashes in your particular state. I'm going to mention this. We kind of plotted our legislation over time. I can tell you this is the last about 38 years in New Mexico, back when we started keeping statistics in 1979. Back in 1982, we had double, twice the national average for DWI crash rates. We were #1 worst in the nation, and you can see that spike right here. Back in, we kind of started doing some things. Got to 1989, we passed our first open container law, and things started going back up a little bit. In 1992, Christmas Eve, a lot of you from that work with MADD may know a person named Nadine Milford. She lost her daughter and 3 grandchildren in a horrific Christmas Eve crash. And that really, just to show that one person and one organization like MADD can really make a difference in legislation. And that was kind of a landmark year for passing legislation. We passed .08 and other things. And you can see right after this particular time, things started going down because of all the reform that we did in New Mexico. And then we kind of hit a little lull here in 1997, 98. We closed drive-up liquor windows in 1998. You saw another kind of decrease. And this is what I'm going to talk about here. Right around 2003, we were spending somewhere around $300,000 to $400,000 in public awareness, commercials, billboards, those type of things. We've increased that to about $3 to $6 million per year. And we made a concerted effort. We have a good enforcement program, but we needed to get the word out there. Enforcement and public awareness go hand in hand, and you need both to have a successful program. And as you can see, that kind of had an impact and went down to 2005. We were the first state to pass mandatory ignition interlock for all offenders, even first-time simple offenses. That had an impact. 2007, we passed medical marijuana in New Mexico. And kind of moving along. In 2014, this isn't a New Mexico milestone, but our neighbor to the north, Colorado, passed their recreational marijuana. I'll show kind of a little bit of impact on that. And in 2008, that I kind of skipped through, we finally fell out of the top 10 worst DWI states in the country, and that was a big milestone for us, and we're still outside the top 10. And just to give you an idea of how legislation can really impact a state. Just because we don't have it legal in New Mexico, we do have it, medical marijuana, just to show you the amount of dispensaries that we do have. So it's across the state, we're a large state, but you can pretty much access it anywhere. And I think nowadays people have gotten really good about convincing physicians that they need their medical marijuana card. So it's not very difficult to get. Mexico's to our south, we border Mexico, a lot of drugs are coming in from there. I know the chief mentioned wind. When we get wind from the west, we usually think the smoke is from California fires. When we get wind from the south, everyone rolls down their windows and open their windows because they think it's the marijuana dispensaries coming in from Colorado. I'm kidding, Chief. This is something that kind of surprised us a little bit. In 2017, the Governor's Highway Safety Association did a study, and they found that of the 57% of fatally injured drivers across the country, 34% of them had a drug in their system, and that was a pretty high number and kind of surprised us. 35% of those had marijuana. We kind of did a little look in New Mexico about drugged-only crashes that were fatal. And as you can see, right when Colorado kind of passed their law, I'm not blaming it all on Colorado, but we had our medical marijuana here that kind of went up, it kind of flattened out. And as you can see, since that law passed, we've had a big increase in the amount of drug-impaired drivers. It's very common in New Mexico for someone to be going to a Denver Bronco game or making a trip up to Colorado, going hiking, skiing, and going around and collecting hundreds of dollars in cash so that they can stop at a dispensary on their way back and then coming back and giving it to their friends. It's very common for us to place orders with the people that are going to Colorado. And so even though it's illegal, because it's legal in Colorado, they think it's okay to buy it over there, come down and distribute it to their friends. You can't get edibles and those type of things in New Mexico unless you go outside, obviously. This is something that the chief mentioned that I want to reiterate very strongly, and that is what the chief is doing by increasing his enforcement in DUI is really not the norm across the country. In New Mexico, as you can see, back in even going back to the 80s, 90s, we were right around 20,000 DUI arrests per year. Over these last 10 years, you have seen this decrease all the way to, in 2017, under 10,000 DUI arrests. A lot of that, people say, is because we have less drunk driving or less impaired driving, but a lot of that is enforcement is just stretched too thin in our state. They have too many responsibilities. It's very difficult to prosecute an impaired driver case due to alcohol, much less than you start adding in drugs. And so what the chief is doing, like I said, is not the norm. We need more chiefs and sheriffs to understand that when you do increase enforcement, you're going to get a decrease in fatalities and a decrease in crashes. This is one of the most concerning things to me, who's been doing this for a long time. This is why I think our country has seen an increase besides last year, but a big increase in fatalities over the last several years. So my portion is really on the media. Why do we do media? It's because it's effective. There's a reason that Budweiser and all these other companies spend millions and millions of dollars putting into TV ads and social media, because it works. Especially works when it improves health behaviors. Your health, getting in a crash, that impacts your health. Dying, getting injured, etc. And the research shows that mass media campaigns do have an impact on changing people's behavior. In New Mexico, we have three main messages. NDWI, I like MADD's message. We don't want to necessarily reduce it. We want to eliminate it and end it. Don't text and buckle up. Those are the three messages that we focus on in New Mexico. I can tell you right now, the big one that we put a lot of money in is an NDWI. We did an MVD survey this last year, and we know we're doing a pretty good job of getting our message out, because for about every $1 million we spend, about 60% goes towards impaired driving, about 30% goes for don't text, and 10% goes to buckle up. When we went and asked what message people recognized, it was about that same percentage. So we know that the more money you spend on a particular issue, hopefully the more recognition and retention it's going to get with your citizens. So what should the message focus on? I think for many, many years, it was a very strong enforcement message. And who is that really speaking to? It's speaking to the offender, right? Showing them getting arrested, showing them being put in jail, showing all the consequences. You're really trying to deter that person from driving. Over the last several years in New Mexico, we've kind of expanded that to a more emotional message, to kind of go with some of the age groups now that we're having to deal with this. Not only talking to that person, but talking to their community, talking to the mom and the dad, the sister. Kind of takes a village, right? Instead of only talking to that one person, we want to get the community motivated to be involved. And I'm going to show a couple of those messages right now. The first one is we did a 12-part series. Each one is about 30 seconds. I haven't, they're not all on here. I kind of condensed them into a 2-minute version of a strong enforcement message. From the time someone first sees those lights in the back of their rearview mirror, all the way through the court, et cetera, till they actually get released and the consequences that they had to go through. So I'm going to show these spots. So we're still using a strong enforcement message, and this is just an example.
Got pulled over last week for drinking and driving. Started driving down the road, not 3 minutes later, there's some lights flashing in my rearview mirror.
Good evening, sir. The reason why I stopped you is you're doing a lot of swerving in the roadway. Have you consumed any alcohol this evening?
Oh, yeah, I had a couple drinks.
Go ahead, shut off the vehicle.
He asked me to step out of the car, and then the reality really sunk in. Got pulled over last week for drinking and driving.
I need you to be further honest with me in how much you've consumed tonight.
I've had 4 drinks.
Go ahead and face towards my unit. You are under arrest for driving under the influence of intoxicating liquor.
Once you hear the clicking around your wrist, everything sinks.
Take a seat.
I thought I was fine, but the reality was is I was over the limit.
TAC 18 Albuquerque, be advised I will have 11015 for DWI.
So I was arrested for drunk driving.
What cell do you want him in?
They told me 24. I don't know what to do. I don't know what my best bet is for not getting hurt. So I was arrested for drunk driving. Oh, they finally granted my release. They have a bus that can bring you back into town if you can't get a ride. I don't want to tell my girlfriend, but I get off the van and she's already there waiting for me. I tried telling her that everything's gonna be okay.
It's not fun.
I disappointed a lot of people, my job, family, girlfriend. You can't erase a DWI.
So like I said, that's actually only 4 of the 12 spots. It shows him getting booked, getting undressed, getting his jumpsuit on. Thing that we tried to do there is make it look like some of these other impactful shows that are out there right now. In addition to using those are actual state police officers, inmates, all of those type of things, because we wanted to make it look as authentic as possible. It's actually won quite a few awards, and we've had a very positive response from our state and the citizens, and on social media, a lot of comments and a lot of chatter about it. We have moved to a emotional message, like I said, to try and get people engaged, try and get people a reaction, emotionally engaged in helping solve this problem. Once again, there were, quite a few people who could have stepped in that night probably, just trying, like I said, to engage our community. This next one is based on a true story. It's actually happened twice. And so just wanted to show this. This is one of, probably the one that we've had the most feedback on.
What is your emergency? 911, what is your emergency?
I need help. I need help.
Are you okay? How can I help you? Are you okay? How can I help you?
I'm scared. I'm scared. It's my dad. He did a bad thing. Dad. He did a bad thing. He did a bad thing. He did a bad
Tell me
thing.
where you are and we can help you. We can get there very quickly. We can help you. We can get there very quickly.
He's been drinking. He's driving somewhere. Now he's driving somewhere.
Where is he driving? Where is he driving?
I think we're on our way home. I think we're on our way home. Can you help me? Can you help me?
Oh my God, you're in the car? Oh my God, you're in the car?
So like I said, that was a true story that's actually happened twice, where we've had someone calling from inside the car. And we had a good response from the public in the sense of they wanted to know how they can help and how they can get involved. And that was the real big push that we tried to do with NDWI is how can you help NDWI, even if you're not the one drinking and driving, what can you do as a community to help and get engaged, which is a lot of what MADD is all about. Who is our target audience? And let me start talking a little bit about drugs now. When we had alcohol as the main focus, we kind of knew who was in our lane, right? They're males, 18 to 34, 18 to 35. We knew what they watched. We knew where they ate. We knew where they drank. We could target media and public education towards them. And I think Staci said it best. This is happening all over now. And the chief said, as JT said, it's all different ages from young to old when you start looking at prescription drugs, opioids, marijuana use. It's 24/7. It's not Thursday, Friday, and Saturday night anymore. It's not that one age group. It's 16-year-olds. It's 60-year-olds. It's across the board. And how are we, as a community, as a state, going to focus our resources to try and address such a wide variation of population? And so I'll talk a little bit about that. We know we have to reach millennials. They're going to be one of the largest populations in several years. We know that millennials behave differently than what we're used to. And I have some statistics up here, and they really are going to shape how our country and our culture is going to be over the next several years. 80% of millennials use between 2 or 3 tech devices at least once a day. My son usually is watching TV with his iPad there. Unfortunately, I try and limit that as much as possible, but we know they're engaged with their devices, with their phones, iPads, all of those type of things. They're not necessarily going to sit down at 6 o'clock at night and watch a television show. So how do we reach them? And the other thing is about 84% of millennials don't trust traditional advertising, so they don't necessarily believe what they see on TV all the time. In New Mexico, just recently, and I think we're one of the first states to do this, we developed a virtual reality. How many of you have done virtual reality before? Put on the goggles. So there's been a few people. And it feels like you're actually in there, right? And this is what this millennial population is attracted to. How many of you know what Fortnite is? If you have kids, you probably know what Fortnite is because that's a new game, but they want to be involved in the action. They want to be part of what's going on. And so we did a virtual reality. We worked actually with our MADD office. We contacted a victim with their permission and was able to do a story from 3 different perspectives: the victim's perspective, the officer's perspective, and the actual offender's perspective. And we bought 3 units with 3 goggles. We were just in Atlanta at the Governor's Highway Safety Association conference. You can actually sit there on a chair. You have to sign a waiver, put the virtual reality, and you'll hear this story and actually be involved. And I'll show you a little bit about what that is or what's seen. It doesn't do it justice because you're not actually have the goggles on, but you can get an idea of what this is about.
The story you're about to see and hear goes in depth into the life-changing effects of drunk driving.
She hands me the angry crow. I don't know what's in it, but it's strong.
Central Dispatch radios me to tell me that someone called in a report of a suspected drunk driver on the interstate.
I'm told that a drunk driver hit my truck.
I made a terrible choice that night, one I'll always regret.
I can't erase that night. I'll carry this with me the rest of my life.
So that's just a sneak peek. It's actually about 6 minutes long, and like I said, had a lot of positive feedback. We're taking that into schools. We're taking that into our motor vehicle division offices. And a lot of us have to wait when we go and renew our driver's license or get a registration. Why not sit there and take a look at this 5 or 6 minutes while you're waiting, trying to get this out there. The thing about virtual reality as well is it has about a 90% retention rate, which is different than seeing a commercial or seeing an ad, which is about 30 to 50% because you're part of the experience and sitting there in the process you have to go to be able to engage that. So that's why we went in that direction. And like I said, I think we're the first state to do that, and I hope other states start using that to engage our young folks. When it comes to drugs, we kind of changed our slogan a little bit so we don't know what we're talking, not our slogan, but our color. We're using the green with the cross. A lot of people are familiar with that. We do some outdoor advertising, still an effective way to reach the driving public. And you can see kind of some of the examples that we've used on billboards, focusing not only on marijuana but on prescription drugs, just basically knowing that it's illegal to drive with any type of drug in your system, including alcohol. We have not launched this particular series. We're probably not going to launch the pipe and the needle, just because we don't feel that if you're actually injecting that into your system that our ad is going to really do much to change your mind. But we do want to get the pills and the marijuana out there. But these are just some ideas that we're still looking over at this particular time. Here's one of our first specifically drug impaired driving spots that I wanted to share with you.
Afternoon, ma'am. Have you taken any medications today?
I can't remember the name of it. It's medicine, not anything illegal.
I'm not drunk or anything.
It's the same thing as if I had like 5 cups of coffee because I can't sleep and I'm in pain.
My doctor prescribed these to me.
Please. No, I'm fine. I'm fine.
And I think what we're trying to also show there is a different demographic, if you notice. They're a little older people, men and women, not your typical 18 to 34-year-old male, trying to cover a little bit more of the population that we're trying to reach. Here's another one.
Hello, sir. Have you had any illicit drugs?
A little bit of marijuana.
I took like a hit.
It's cannabis, dude, so it's legal, right?
DWI, that's like drunk driving.
There's no law against driving high.
I'm a little foggy, but I'm good.
They're just cookies. They're legal in other states.
But everybody out here smokes pot.
I'm fine. I've done this a million times.
And here's some on prescription drugs. And one last one specifically on marijuana.
Come over. It's not that far.
Oh, babe, I can't drive. I'm blazed.
Come on.
Okay, I'll be right there.
So I want to wrap up just so we have some time for questions, but those are just some of the examples that you can do. What I want to also say is all of these are supported with big social media campaigns. So all of this we plug in through geofencing, through Facebook and other types of social media. If you've ever looked at like Amazon and found a pair of shoes you wanted and then you go to your Facebook page and you see those same shoes in your Facebook page, that's kind of how geofencing works. And so we try and implant that throughout the social media to try and get to our target population. Everyone's on Facebook or Instagram or Snapchat now, and so we need to use that. Even my 60-year-old mother has a Facebook account, so we know that we can reach a lot of people through that venue. The three concerns I have really are new legislation that we talked about, legalizing marijuana, those type of things. We've spent a lot of time, like I showed over that graph, passing laws that impact and reduce impaired driving. It seems like we're going a little bit in a different direction now. You know, I was interested when the chief talked about having the marijuana there by the person's foot when you made that stop. We need to have some type of open container laws for marijuana as well. It's not legal to drive with an open beer. It's not even legal in our to drive with an open beer in the back seat or if you're a passenger. And why is it legal to have an edible in the seat next to you and those type of things? So we need to start shifting the legislation back to try and contain that while you're driving at least. Law enforcement, I showed the graph. We really need to figure out a way to support law enforcement, motivate chiefs and sheriffs to think this is important. Because if we don't have the enforcement, it doesn't matter what laws we pass, it doesn't matter what public education we do, we're not going to have the impact that we need in order to continue to reduce drunk driving. And the other thing is now we're dealing with a very broad demographic, like I mentioned before. It's not a very targeted audience. It's everybody. It's men, women of all ages. And how do we use our state resources and our resources to really try and focus in to get the message out to the people that we want to see? So we need to really look at your state specifically, figure out where you would get the best bang for your dollar, and try and impact the population in that particular area. And the last thing is our goal is to eliminate drunk driving. We want to end it. In New Mexico, we've been able to have a constant downward trend for the last 35 years. 2015 was our all-time low. We had 123 impaired driving deaths. This year, we're looking right now, depending on what happens the rest of this month, November and December, to do a new record low. We're going to probably be under 123. I'd love to have obviously zero, but progress is a good sign. And so I think some of the things that we're doing are really impacting and helping, even though we have new and higher drug impaired driving rates in our particular state. So keep working, focus on those three areas would be my advice. Try and find more people like the people to my left in Washington, Colorado, aggressive chiefs. They also have good public awareness spots. If you have a chance, go to their state websites, and they also do some really good things. But we need people more like the chief who are doing it, law enforcement who's going to take it really seriously, because that's going to have the biggest impact. So I think at this point I'm done and ready for questions.
All right. Well, we're close up on the time here. Do you want to do? Carol's coming up.
Definitely it's time for a break, but I do want to thank you, JT, and the wonderful panelists. When we said jam-packed, I think I didn't know what I was saying. I don't know what's better than jam, but definitely we were packed with information, and thanks to all of you for your various perspectives on a lot to think about, a lot for us to consume. And next up is the local panel, so you'll hear from people doing this kind of thing right in your backyard. We have a few questions for the first panel. Okay, Karen, do you want to come up and again, we so appreciate the first panel, and we'll take just a few minutes for questions, because the national speakers will also be available this afternoon when we move into breakout sessions. So they're in a spot, they'll be in a spot where you can ask them questions then too this afternoon. Okay, Karen?
And also, I think you've seen that we were able to answer a few of the questions too. So, and some of these questions will probably be coming up for the local panel as well. So we started a couple of questions that we want to be immediately addressed. Okay, let me read it. Has the legalization of marijuana in those 9 states increased the number of traffic accidents, crashes, and fatalities over states where it is not legal? So, for our national speakers.
In Washington, it did not result in an immediate increase in fatal crashes, but in 2015, we experienced a 20% increase in fatal crashes, which was higher than the national increase, and marijuana is a part of that, but it's driven more by the polydrug users than it is marijuana specifically.
Yes, in Colorado, we've seen a higher number of fatally injured drivers with THC in their system than previously.
So next question, this is for Chief Ticer. Any programs to educate judges on DRE enforcement, problems getting convictions?
Thank you. The question is a good one, and we actually, on our Colorado Task Force on Drunk and Impaired Driver, our state mandated task force that I mentioned I chair, one of the seats, all the seats that are at the table there are mandated by statute, and we do have a judge on our committee, on our task force, Judge Casillas. He's a wonderful man. He's focused on this, so we constantly feed him information, and then he's able to share that with his colleagues, judge to judge, and get that information out. And the Highway Safety Office does put out programs to educate the judiciary as well too. So there's definitely some opportunities there. Jury trials, when it comes to DUI drugs, especially cannabis, they're always challenging, whether it's alcohol or drugs. And the nanogram level is problematic, as I mentioned before, because when those blood results are coming in under 5 nanograms, it's very difficult to get those cases through the court. So we do have some challenges, but we are getting convictions as well.
So in the interest of time, we are going to stop with the questioning there. But we wanted a quick review of Slido for those of you who may have come in late and missed the first tutorial. So what we're doing is crowdsourcing questions for our panelists. And if you go to connect to the Wi-Fi here or your own cellular data network, open up your browser and go to slido.com. And then the event code is MADD Hawaii. And then you'll be able to see an area where you can put in your question, and you can upvote other questions too, and the questions with the most votes are more likely to get answered.